Happy to have with us at ASCO 2011 Dr. Susan Littman from Thomas Jefferson University. She's the Director of Cancer Genetics and the recent Clinical Director of GI Oncology. Thanks for stopping by here and talking with us. Let's talk first about cancer genetics, what you're doing at Thomas Jefferson.
Okay, we're going to be primarily focused on providing good clinical genetics. That is to say that people are going to be screened at their initial diagnosis for genetic defects, for example, in DNA mismatch repair, all colon cancers, newly diagnosed, both the colon cancer and polyps will be screened for defects in DNA mismatch repair, and then that information provided to the oncologist and the surgeon, such that the appropriate surgery can be done and that information can be utilized in caring for the patients.
Now, cancer genetics is really a growing field, both in terms of treatment and research.
Exactly, the importance of it overall is that this information is vital to oftentimes to both the treatment in terms of the medicines that we use, the drugs that we use to care for, to treat patients surgically, and also important in terms of deciding on the correct surgery, because particularly with Lynch syndrome, these patients have a propensity to develop other cancers, and therefore it's important to have a full colectomy if it's a colon cancer, and also to have appropriate screening to evaluate for new cancers. And interestingly, it also with the defect is certain sensitivity or resistance to all of our chemo, not all of our, but many of our chemotherapy agents. So you would utilize the information in selecting the most appropriate adjuvant or adjuvant chemotherapy for these individuals.
I understand you have some open neoadjuvant and liver cancer studies.
So I've been primarily focusing on the cancer genetics, but in terms of treatment, focusing on liver cancer. We have a number of phase 3 drug company-sponsored studies, and then our own IITs, in particularly in looking at a drug that may be helpful for both stabilizing patients prior to transplant, and but we're testing it in patients third line or second line that have no other options for treatment of their liver cancer.
Can you give us some information on the pancreatic cancer study you're beginning later this summer?
Yes, the pancreatic cancer studies are going to focus on testing a new strategy for downstaging patients that are locally advanced, to attempt to allow those patients to undergo surgery, which is at this point the only potentially curative modality in pancreatic cancer, and then also combining my interest in cancer genetics with employing a PARP inhibitor to standard chemotherapy in the treatment of metastatic disease.
Dr. Littman, thanks for joining us and sharing your work with us.
Thank you.
Dr. Susan Littman, she is the head of cancer genetics and the clinical director of GI oncology at Thomas Jefferson University in Philadelphia.